So much, Mr. President. Dr. Fauci said earlier this week that the lag in testing was, in fact, a failing. Do you take responsibility for that? And when can you guarantee that every single American who needs a test will be able to have a test? What's the date of that?
Yeah, no, I don't take responsibility at all because we were given a set of circumstances and we were given rules, regulations, and specifications from a different time. Wasn't meant for this kind of an event with the kind of numbers that we're talking about. And what we've done is redesigned it very quickly with the help of the people behind me. And we're now in very, very strong shape. I think we'll be announcing, as I said, Sunday night. And this will start very quickly. And we'll have the ability to do in the millions over a very, very quick period of time. So no, and what we have done, and we are going to be leaving a very indelible print for the future in case something like this happens again. But it was and that's not the fault of anybody, and frankly, the old system worked very well for smaller numbers, much smaller numbers, but not for these kind of numbers. Tony, maybe you'd like to say something?
Will you have,
Tony,
yes, please, by Sunday night, will every American be able to get a test?
So just to reiterate what I said to many of you multiple times, it's a distance of a system. The system was not designed for what it was designed for. It worked very well. CDC designed a good system. If you want to get the kind of blanket testing and availability that anybody can get it, or you could even do surveillance to find out what the penetrance is, you have to embrace the private sector. And this is exactly what you're seeing, because you can't do it without it. So when I said that, I meant the system was not designed for what we need. Now, looking forward, the system will take care of it.
Mr. President,
and
with respect,
interestingly, if you go back, please, if you go back to the swine flu, it was nothing like this. They didn't do testing like this, and actually they lost approximately 14,000 people, and they didn't do the testing. They started thinking about testing when it was far too late. What we've done, and one of the reasons I think people are respecting what we've done it very early. We've gotten it very early, and we've also kept a lot of people out.
Mr. President,
yes,
the
please,
last administration
please.
said that they had tested 1 million people at this point. You've been
Well, ask them how they did with the swine flu. It was a disaster.
But with respect, you've been
Next, please.
for 3 years.
Next, please. They had a very big failure with swine flu. Very big failure. Go ahead, please.
This question is for Doctors Fauci and Birx. Dr. Fauci, based on what you currently know, what is the trajectory for when this outbreak will peak? How long will the American people have to remain on this emergency footing? And for Dr. Birx, as the administration tries to get its arms around this test kit shortage issue, the next glaring need could be respirators and related hospital equipment. So what is the administration doing right now to ramp up production of respirators and that kind of equipment should this outbreak persist?
So when you have an outbreak like this, particularly if you're trying to interfere with it, it's really impossible to predict the time element of when it's going to peak and when it's naturally going to go down. So if you look at the situation where countries really did not get to the point of trying to contain and mitigate very well, you see a peak over several weeks and then down again over other several weeks. What we're trying to do with the efforts that we're doing is to blunt that peak. And I mentioned it many times, and I think it's important and appropriate for me to mention it again because it answers your question. When you talk about preventing infections from without in, which is the kind of travel restrictions we're talking about, then how do you handle what you already have in your country? You continue some sort of containment, but you also do mitigation. And you try to proportion it to the areas where there are the most infections. The success of that and how much you make this turn into this is going to give you the amount of time. If we're successful, it'll be less. If we're not successful, it's going to be more. But these kind of things generally run out in a few months. Hopefully, we'll make it several weeks, 8, 9, whatever weeks. But I can't give you a number because it depends on how successful we are.
Great, thank you. It's a great question, and Dr. Fauci and I have worked together a very long time and continue. It's a privilege to work with him every day. So I think you can learn and I appreciate there were some graphics done by some of the reporting over the last several days. If you align the data from China with the data with South Korea, you can start to see almost a complete overlay of that data. And so that's what we're tracking very closely, as well as Italy. But you have an excellent question. I just want to make one note. In South Korea, I want to repeat, only 4% of the tests were positive. That means 96% of the people had a different respiratory disease, because we're in the middle of flu season, cold season, and all of the other respiratory diseases that we get every day. In LabCorp and Quest early data, they're running about 1 to 2% positive. That means that we have a lot more other respiratory disease out there besides the coronavirus, and that's why the screening is critical. But even with the screening, we're going to run what we think are very low rates. Needless to say, though, we're taking it extraordinarily seriously to plan for what could come. Not what Dr. Fauci talked about, blunting the curve. That makes it much less high need at that peak of the curve that we're all planning for. So we're in full inventory of all of our assets by the president unlocking and this emergency order and the secretary of HHS's ability. It unlocks all of those stockpiles, those needs, what the VA has, what the DOD has, what the National Guard has, and what every hospital has. And the hospital emergency preparedness plan allows them to defer elective issues to keep those hospital beds open for those who might need it. So we're in full planning mode for each of those things.
And I might add that we are in the process, and in some cases have already done it, ordered a large number of respirators just in case. We hope we don't need them, but we've ordered a large number. Go ahead, please. Go ahead.
President. I'd like to ask Secretary Azar and Dr. Fauci just how Dr. Fauci, okay?
Right,
all right.
better. Not 100%, but 90%.
Right.
Go ahead.
This affects the elderly primarily, and in that sense it's an unusual disease. Is any specific research being done as to why it affects our senior citizens more than others?
So I don't mean to diminish your question, but we already know why it would affect senior citizens more. Because when you talk about anything that requires a robust immune system, as you get older, your immune system is not as potent as it is when you were young. And that's the reason why when you talk about even influenza, which we have extraordinary experience with over decades and decades, the people who are very vulnerable are the elderly and those with underlying conditions. The same thing holds true for a variety of other disease. Why cancer is more prevalent in mostly in older individuals, because the immune system that screens for it is less robust. So it really is something that is kind of well known over a lot of studies.
Okay.